Today, we are going to be demystifying a condition that is just so incredibly common, but honestly so often misunderstood. We're talking about polycystic ovary syndrome, or PCOS. We're going to break down exactly what it is, what to look for, and how it's managed, all based on the latest science and guidelines. Okay, let's get right into it. So let's just start with some of the things you might notice first. Maybe your periods are, well, they're all over the place. Or you're dealing with acne that's sticking around way past your teenage years. Or maybe you're just struggling with weight gain that doesn't seem to make any sense. These are some of those really common and frankly confusing symptoms that might be pointing towards PCOS.
And if any of that sounds familiar, you are absolutely not alone. Not even close. Here in the UK, it's estimated that about 1 in every 10 women of reproductive age is affected by PCOS. That's a huge number. It makes it one of the most common endocrine disorders out there. And yet, there's still so much confusion surrounding it.
So, let's get the fundamentals down. What exactly is PCOS, and how do doctors go from those kind of vague, common symptoms to an actual concrete diagnosis? Okay, so at its very core, PCOS is a condition that impacts how the ovaries do their job. But here's the really crucial part to understand. It's not just a reproductive thing. It's both hormonal and metabolic. And that combination is exactly why it can cause such a wide range of symptoms.
Now, let's clear up a major point of confusion. And it's right there in the name. Polycystic makes it sound like you have a bunch of cysts, right? But you don't. Those things that show up on an ultrasound, they're actually these harmless, tiny, undeveloped sacs called follicles, which is where eggs are supposed to develop. With PCOS, these sacs often can't release an egg, and that's what messes up ovulation.
So how do doctors make it official? Well, they use something called the Rotterdam criteria. Think of it like a checklist. You need to meet at least 2 out of these 3 conditions to get a diagnosis. First, having high levels of androgens, which are often called male hormones. Second, ovulatory dysfunction. That means irregular or completely absent periods. And third, having those polycystic-looking ovaries show up on an ultrasound.
And you can see how those criteria lead directly to all these common symptoms. The irregular ovulation is what causes the irregular periods and can make getting pregnant more difficult. And those high androgen levels? Yep, that's what can lead to things like excessive hair growth in places you don't want it, stubborn acne, and even hair thinning on your scalp.
All right, so now we know what PCOS is and how it's diagnosed. So let's get into the why. What's really happening inside the body that's causing all of this to happen?
This number right here, it's a huge piece of the puzzle. Up to 75%, 3/4 of women with PCOS who are also obese have something called insulin resistance. And it turns out this isn't just some side effect. For many, it's a major driver of the whole condition.
And what's so fascinating is how it's all connected in this feedback loop. See, when your body becomes resistant to insulin, your pancreas just works harder and pumps out more of it to compensate. But all that extra insulin floating around, it sends a signal to the ovaries to start producing more androgens like testosterone. And boom, that hormonal imbalance leads to so many of the symptoms we just talked about. This really is the central idea. The big takeaway is that in a majority of PCOS cases, it's the metabolic problem, the insulin resistance, that directly triggers the hormonal problem of high androgens. And that's exactly why managing PCOS often means you have to tackle both issues at once. Okay, so we've got the what and the why. Now let's talk about the most important part. What can we actually do about it? And this isn't just about covering up symptoms, it's about building a real long-term strategy for your health. And you know, the international guidelines are crystal clear on this. The number one, first-line, foundational approach for every single person with PCOS is lifestyle intervention. That means things like diet, exercise, and stress management are the starting block either on their own or right alongside any medication. And the goal here doesn't have to be massive to make a huge difference. Get this, research shows that for women who are overweight, losing just 5% of their body weight can lead to really significant improvements in insulin levels, how the ovaries function, and a reduction in those androgen-related symptoms. Just 5%. So what does that lifestyle plan actually look like? Well, it's really about focusing on these key pillars: a nutrient-rich diet full of whole foods, getting in regular physical activity, and making stress management a priority. These things all work together to help improve your body's sensitivity to insulin and support your overall health. But, you know, sometimes lifestyle changes alone aren't quite enough to get everything under control, and that is perfectly okay. That's exactly when medical therapies can come into play, designed to target the specific issues that are still lingering. So, the two most common medications work on two totally different parts of PCOS. On one hand, you've got metformin, which goes after the metabolic side of things. It helps your body use insulin way more effectively. And on the other hand, you have birth control pills, which target the hormonal symptoms directly by regulating your cycle and helping manage things like acne and unwanted hair growth. And for a lot of people, it's not an either-or situation. In fact, using both medications at the same time can be really effective because you're tackling the condition from both angles, the metabolic and the hormonal, all at once. Because PCOS is a lifelong condition, managing it is also about looking ahead. It's about being proactive and thinking about how to reduce the risk of other health issues down the line. See, because of that metabolic piece we talked about, PCOS is linked with a higher risk for conditions like type 2 diabetes, high cholesterol, and heart disease. Now, this isn't to scare you, but it's why having those regular checkups and an ongoing conversation with your doctor is just so important. But the impact of PCOS isn't just physical. We absolutely have to talk about the psychological side of things, because the mental and emotional toll of managing a chronic condition and its visible symptoms is very real. And the data here it's pretty stark. Studies have shown that women with PCOS have significantly higher odds of dealing with both depression and anxiety. And it makes sense, right? When you're dealing with the challenges of weight gain, unwanted hair, or fertility struggles, it can take a real hit on your self-esteem and your body image. And that really brings us to our final and most crucial point. Yes, PCOS is complex. It's multifaceted, but it is absolutely 100% manageable. The real key is building a partnership with your doctor, creating a plan that's tailored to you and your goals. By combining smart lifestyle strategies with the right medical support, you can not only get profound relief from your symptoms, but you can also set yourself up for great long-term health.